My name's Jeff, and I'm talking with
Jeff.
Jeff.
Oh.
There you go. He's a senior at Buffalo State College, and we're talking about health insurance. What type of health insurance do you have?
Blue Cross Blue Shield. I'm not sure exactly the plan, but
Okay. And have you ever had to use it before?
not very much. Just for menial things.
Okay. Being a senior, after you graduate, are you still going to be with Blue Cross?
Yeah, I mean, I guess for the time being, it'll probably expire since I'm obviously over 21, almost the age. But
So you're not sure?
no. Yeah, I mean, I guess it's really to find some kind of job
Right.
that gives
So
healthcare.
would you say that you haven't really thought about it too much?
Not very much. It's one of those things that kind of stalls in the
Right.
back of your mind and stuff.
Exactly. So would you agree that that's the thinking of most people our age?
Yeah, I actually talked to a lot of people that they don't it hasn't come up. I mean, then when they talk about it, they're just like, what am I gonna do?
Right. Do you have any solutions at all?
Well, obviously, universal healthcare would be nice, but other than that, it's just like you did.
Hey, how are you? What's your name?
Charles Wooters.
Charles Wooders. What is your standing here at Buffalo State College? Your year?
Junior enrolled in a criminal justice program.
Okay, and do you know about your health insurance?
Somewhat.
What do you know about it? You know
I
the name
have,
of the...
preferred care. I'm on my father's health insurance policy.
Okay. And what do you plan on doing when you are a senior about your health insurance?
I haven't thought that far ahead.
Hi, how are you today?
I'm fine. How are you?
I'm good. And what's your name?
Ashley Warren.
And what's your status here at Buffalo State College?
I am a senior here at Buffalo State College, sociology major.
Okay, and can you tell me a little bit about your healthcare provider?
Yeah, if I had one, I would definitely let you know.
You don't have health insurance?
No, I don't have health insurance. I'm one of the many million of Americans that don't have health insurance.
And why is that?
Because my mom kicked me off when I turned 21.
So what are you going to do when you graduate school? What are you doing now? Are you just like roaming around the streets, make sure you don't get hit by a car?
Yeah, let's hope we don't get hit by a car. But pretty much, yeah, just roaming the streets, trying not to get too sick, trying not to hack up stuff,
Are you going to look for a job that has benefits, so you be able to have some type of insurance?
Yeah, pretty much. That's pretty much what's going to happen here because you never know. I might get shot, tomorrow. And I ain't got no health insurance, so.
How come you taking this as a joke? This is serious.
I know it's serious, but it's just funny the way that I did not acquire health insurance after I turned, I want to say 20. Like, I told my mom she could still keep me young, but I guess she didn't want to.
Okay, thank you, Ashley. Hi, how are you?
I'm good, and yourself?
I'm well. What's your name?
My name's Erica Murphy. I'm a junior here at Buffalo State College. I'm a social work major.
Do you have health insurance?
Yes, I do. I have Medicaid, and one time my Medicaid ran out. It was like the scariest thing in the whole entire world. I had to renew it, and I'm a hypochondriac. Like, I go to the doctor every weekend. Like, that's what I do. So I really was frightened when that happened to me.
Okay, and being that you're a junior here, what are you going to do next year when you graduate and you become a senior? Like, what are you going to do about your health insurance?
Well, I think from my understanding that I'm still going to have it as long as I'm in school and I'm bored. Like, I'm going to grad school after this. So I'm not going to be making no real money until I actually start my career. So hopefully with I really believe that you have it until you actually become a working, well, I do work, but where I could be able to have it for myself and like my future family. So either way, I'm sure I'm going to have health care. I believe so, but I'm not really sure.
You're not sure?
No, because from my understanding, if they could freaking, not trying to be funny, but if they can give all these other people things, they can at least give me a basic necessity of health care. Like, they have all these programs for not trying to talk about anybody, drug addicts and everything else. So hopefully they can support me with my health. Like, I'm going to be a working part of the society. I'm going to need health care.
But do you know that there's a lot of people, there's millions of people out here that don't have health care? And you're saying hopefully they can
They're
support
in
me.
the, from my understanding, because there is like healthcare for elderly and children, and then it's like the in between healthcare. But from my understanding, if you're the in between is usually college students and people that's like at the dawn of their starting of their career. So hopefully I'm not one of those. Like I've always been a part of. I always had Medicaid since I was little. Like my family has never really been that well off to not have Medicaid. I'm the oldest of 10, so all of us have Medicaid. That's something that's definitely needed for 10 kids. Like anything can happen. Somebody could get cancer, God forbid, knocking on wood, but it could happen.
Okay.
And
Well,
that's not wood.
thank you for sharing your insights. Hi, how are you?
I'm good. How are you?
I'm good. And what's your name?
I'm Michelle Maxwell, and I'm a senior at Buff State College, communications major.
Okay. And do you have health insurance here?
Yeah.
Is that through the school?
I'm sorry?
Is that through the school?
Yeah.
Okay. And you said you're a senior, correct? Mm-hmm. So being that you're a senior, what are you going to do about your health insurance once you graduate?
When I graduate, I don't really know. I'm not gonna lie. I have no idea.
Okay.